Hey everybody, welcome to PharmChats. My name is Hershan Sanjanwala. A lot of people call me Hershey, like the chocolate. I'm this year's student body president of the pharmacy school, but honestly, there's not a lot of duties now with coronavirus going on. So anyway, I'm just a P3 student at the University of Mississippi School of Pharmacy. And so I'm joined here today with Dr. Jamie Wagner, as well as Dr. Nicole Ashpole. Personally, they are some of my favorite professors, and I know a lot of my classmates would actually say the same thing. They are amazing in their respective fields, and we're about to hear more about that research in just a moment. They're outstanding professors. They'll walk into a room and they'll just litter their lectures with like stories and just make it really exciting. And they really just bring them to life. So the two professors we have are Dr. Wagner and Dr. Ashpole. Dr. Wagner is a clinical assistant professor of pharmacy practice at the University of Mississippi School of Pharmacy in Jackson. She completed her PharmD degree at Midwestern University Chicago College of Pharmacy in 2012, her PGY1 pharmacy residency at Henry Ford Hospital in 2013, and her Infectious Diseases Pharmacotherapy Outcomes Fellowship at Henry Ford Hospital and Wayne State University in 2015. Dr. Ashpole received her Bachelor of Arts in Biology from Concordia College in 2007 and her PhD in Medical Neuroscience from Indiana University School of Medicine in 2012. She did her postdoc research in the laboratory of William Sontag. I believe I said that correctly. Did I say that right?
Yep.
Okay, good. And at the Reynolds Oklahoma Center on Aging within the University of Oklahoma Health Sciences Center. Now she's doing independent research at the University of Mississippi School of Pharmacy in the Department of Biomolecular Sciences as an assistant professor of pharmacology and a research assistant professor in the Research Institute of Pharmaceutical Sciences. So these guys are big names, and I feel very, very lucky to be here and interview them. And so with that being said, how are you guys doing?
Doing well, thank you.
Yeah, excited to be here with you today to talk about what's going on with us.
Good, good. I am also excited. So our first question is for Dr. Wagner. Tell me about how you got into the infectious diseases and infectious diseases related research, and tell me a little bit about how it's like COVID related.
Okay. So everybody's story is going to be different. So I'm just going to throw that out there. For me, I actually didn't start out wanting to do pharmacy. I was a very big marine biology nerd. So I always thought I would be living out on a boat studying humpback whales for the rest of my life. 6 months on a boat, 6 months in Hawaii. I thought that was going to be my future. And life clearly had other plans. But after I graduated, I wanted and started pharmacy school. I wanted to stay doing research. So I had picked up research in undergrad, studying some fish predatory habitats. And so I kind of wanted to stay biology related. And you're like, well, pharmacy is biology, but like organism related. And the only organisms that you can truly kind of study in people are invaders. So our microorganisms, our bacteria and viruses and parasites. And so that was kind of my in to infectious disease research. So Midwestern hosts a research forum every winter for all of the faculty to come and present what kind of research they're doing. And so P1 year, I was like, yes, this is my in. This is my opportunity to get involved in research. And so I kind of just fell into one of the professors that was doing ID related research and completely fell in love with it. And just have done it ever since, and completing the fellowship again, like research is still kind of my thing. As of right now, I haven't really gotten into any COVID related research. Most of it's all been based off of antimicrobial stewardship. So still optimizing antibiotic use. And we know right now that antibiotics are kind of just being used heavily, even if it is COVID related, because we're not quite sure. So there is recent research out there saying that there's less likelihood for bacterial co-infections with COVID. So trying to now use that to spur on future research to say, hey, maybe we don't need these antimicrobials in these patients right now.
Mm-hmm. Right, and yeah, and antibiotic stewardship is really, really important. And I like that you started research in P1 year. Is that what you said? Oh,
yeah,
wow. Okay.
Yeah.
That's crazy. Well, thank you for telling us a little about that. For Dr. Ashpole, tell me how you got into the neuroscience and neuroscience-related research, and if there's anything COVID-related with that as well.
Yeah, so I guess my specialty area would be the aging brain and dementia. And it's kind of started because I spent an abnormal amount of time in my childhood in a nursing home. So my family for multiple generations has worked in assisted living facility, a nursing home, or a geriatric patient care center. My mother is the director of nursing at that home. My great-grandmother was the director of nursing at that home. And so my grandma worked there. Everyone in my family has worked there. And so I grew up watching people in their final stages of life and spending a lot of time interacting with people who were undergoing those changes in their brain and changes in their physical abilities. And so it was just really natural to me to be around aged individuals and to want to know what's happening and why some people would change their personality, or why my great-grandmother would refer to me by my mom or my aunt's names. And so I myself worked in the nursing home throughout high school and a little bit in college. And so I thought I was going to go on the pre-med track. But then part of me thought, I'd already seen enough deaths and I wanted to be on the other side and try to figure out what's happening in the brains. And so I decided to go off and get my PhD in neuroscience and specialize. In the beginning, I did a lot of molecular neuroscience research, and then I went to Oklahoma to an aging center where I got to learn about behavioral neuroscience in aging. And so now that's what my lab works on here. In neuroscience, you learn so many techniques, that allow us to see into the brain and to try to understand what the brain is doing. And so it's been really interesting in the last few months because I've been working with COVID researchers, even though I'm a neuroscientist and I don't understand viruses. I'll be the first to admit I don't understand or know a lot about infectious diseases. But there were teams here at the university and then elsewhere that needed help really quickly taking what they were researching, actual viral specialists, and they just needed assistance. And luckily I was able to have a toolkit that could benefit some COVID researchers. So Dr. Joshua Sharp in the Department of Biomolecular Sciences, he specializes in looking at structures on things outside of viruses. And so if you look at COVID and you see the spikes off of COVID, he's really got some breakthrough technologies in trying to understand their structure. And that's a really big target right now. So he's working with team members down at UMMC, like Dr. Ritesh Tandon, but then also researchers in New York and in other places across the United States, and trying to move forward molecules that might be able to block those spikes. And so he came to me just asking for some microscopy image analysis tips. And as a neuroscientist, I do a lot of microscopy. And so I was like, I'd be glad to help if I can. Plus for me, sitting at home during a huge crisis like this and not being able to help, I wanted to help. And so when they said, if you want to help count some cells on the microscope, we would love to help. So I took that and I jumped in and I spent evenings and weekends trying to assist in whatever way I could. They have some compounds that they also wanted to measure toxicology on, and so toxicity, and I know how to do those studies. So I tried to help with those as well. And I'm really excited and I'm hoping that it's helpful to them and they can move forward. So yeah, it's a bit different than Dr. Wagner because I'm a neuroscientist who stumbled into trying to help with COVID, even though I don't honestly know what I'm looking at on a lot of the pictures that I've seen. I'm just trying to do the analysis that would help them and hope that it comes to something in the future.
Yeah, thank you for that, Dr. Ashpole. I love that, we're getting two different completely sides of research, we're getting that clinical, but also neuroscience, and that's great to me. Also, Dr. Ashpole, I think it's incredible how in class, it seems like you have had this this background of very, very sad moments and tales, and how you're able to spin that and just continue researching is pretty cool too. So. Well, congrats on the coronavirus research, and I'm sure that's very rewarding as well. So for Dr. Wagner, who in the infectious diseases field do you admire and why?
There's a lot. So there's a lot of people. I think one of the big things is that's actually happened probably relatively within the last 6 to 7 years, is the field of infectious diseases have just exploded on Twitter. We are, a good number of us are all on Twitter, and I think that has helped to really get a bigger idea of who exactly is doing any kind of research, or who exactly is, practicing in particular ways, because we all start sharing, our opinions of, oh, this article just came out, here's our take on it. Or, we ask a question on Twitter, like, hey, how are you guys managing this kind of patient with this infection? Or especially with COVID, of how are you handling some of these drugs that we need to treat these patients with? Who's getting remdesivir, who's not getting remdesivir, when, the federal government didn't know how they were going to be distributing the drug to patients. So that was all over Twitter for all of us to connect together and say, here's how we're using it. We created, or one of the clinicians created a Google Doc. And so everybody could click onto that link and see how everybody was getting the distributions to say, hey, this state is getting this, but it's all going to this one hospital. So this hospital, I think it was Massachusetts, like in the Boston area, only one hospital was getting it. And so they were like, hey, we have this many, how much do you need from us? And they were independently starting to distribute the remdesivir out to go ahead and help the other hospitals that weren't getting it allocated to them. And so that was like the beginning stages of how we were all using social media even to help each other. And so I think to pinpoint certain people, it gets a little challenging when all of us are in this together. For me personally, I have 2 people that stand out to me, and those were the 2 people that kind of impacted my research the most. And the first one is Dr. Mark Sheets. So he was my pharmacy professor that I got hooked up with P1 year to start doing research. So Mark was kind of my catalyst person to get moving forward on all of the ID related things that I was going to be doing. And then my fellowship director, Dr. Susan Davis, is the other one. Both of them are probably, less than 10 years out from me. So, still older than myself. But at the same time, they've accomplished so much in their careers in so little time that I just want to be like them. You see somebody and you're like, you've done so many things and impacted so many people. It's like, I want to be just like them. I want somebody to say their name, people say their names and they know who they are just by, either their service to organizations or contributions to infectious diseases or contributions to pharmacy and what infectious diseases pharmacy is. And it's like, that's what I want to be able to do, is I want to be just like them. So, and there's other people too that obviously on Twitter that I just can't name, but we're all in this together, I think. And being on social media and seeing all of these people, you feel more connected to more people, even though it's all virtually, where we're at a meeting and I'm like, oh my gosh, I can finally see you in person. I'm your Twitter friend. We tweet back and forth all the time, and here you are in person. It's so nice to finally meet you. And so it's just a blossoming of a friendship and relationships that are there. And so it's really, again, hard to pinpoint specific people outside of, direct influencers for me, just because everybody is doing so much amazing work for not just COVID, but in general.
Oh, yeah, thank you so much. And did you have a chance to look at that Google Doc?
I did not, because I was not personally involved in allocating remdesivir for my practice site.
Yeah, okay, that's pretty cool. And for Dr. Ashpole, who in the field do you admire and why?
Well, I think first I should say that I clearly need to get on Twitter, so I can start connecting like Dr. Wagner has. Yeah, but like her, I think there are just so many people that I don't even know where to start with a question like that. In my field, there have been so many forward thinkers and people that have really been able to push us into, asking questions we've never been able to ask before. But I think the people that I respect kind of the most are the ones that are able to give us the tools we need to be able to carry out some of the research. And there have been so many breakthrough technologies. I don't understand how to do technology development, so I really appreciate when these tools are made. And so there's leaders in neuroscience, like Carl Dieser-Roth. I mean, he's very well known for all the tools that he's made, and others. And most importantly, it's his team and their teams. It's not just one person, even though they might be the one who gets on the TV or is noted in the science articles. But these people have just teams of experts and forward thinkers that are really important for us. So, personally, I agree with Dr. Wagner. A lot of the people that I respect and admire the most are the ones who've been direct mentors to me. I'm still very close with my PhD mentor, Dr. Andy Hudman, who's now at Purdue. I just think, he's able to challenge me, and I appreciate that challenge. I really appreciate people who are great mentors. And so there are, people who are well known in the field as forward thinkers and as mentors. Neuroscience just recently lost a really incredible mentor whose name was Ben Barris. But even within our department, I have just great mentors with Dr. Willett and Dr. Romaldi. And I also get really excited and admire the people who are just really into their science. There are people who are just really passionate about what they do, even if I don't understand it. And so, that could be the colleagues over in biology or people like Dr. Cole Stevens in our department. I mean, I don't know what he does, but he is so excited about it, and he is so passionate about it that it makes me excited about it. And that's the type of scientist I want to be, someone who's excited about work, someone who's a great mentor, and then who can push ideas forward, or at least help the next generation be able to push ideas forward.
Thank you for that answer, Dr. Ashpole. So this next set of questions, I'm definitely interested in, especially because I'm interested in the academia field. And so for Dr. Wagner, how do you incorporate infectious disease into your role as an educator?
I think I get an advantage here over Dr. Ashpole in that microorganisms are everywhere. And so they're always going to pop up, always. I saw a special one time that kind of broke down how many human cells are on a human body, and then how many bacterial cells, and they outnumber us like 3 to 1 in our own bodies. So we're actually more bacteria than we are human. Fun fact. And you're like, I'm going to go scrub in the shower now. But that being said, incorporating ID into education really isn't that hard, because you're going to see infections everywhere in every patient. It doesn't matter what field you go into, there's always going to be some sort of infection regarding something. And so that doesn't necessarily seem the hard part. The hard part is students either love it or hate it, because it's either really easy or really hard. And so I think as an educator, it becomes more difficult to help the students that don't quite get it, that it just doesn't click with very well, and trying to make it into something that they can understand, that can make sense. So, especially some difficult topics like, PK/PD, so understanding how drugs work the way they work, why we infuse them the way we infuse them, and trying to liken that to hits in baseball. One is a pop-up, an infield fly, and then another one is, a nice lob that gets you to second base, and then another one's a home run, and that's what their PK/PD profile would look like to best kill bacteria. And so trying to make ID concepts more relatable to real life, everyday things, because we really can't see this. So probably similar to Dr. Ashpole, you can't see it with the naked eye. And so it makes those concepts difficult to understand when you can't see it. So if I can make these things easier by relating it to something that we can see, then I think that's where I find my joy in teaching ID to students, is I can see them be like, oh, okay, now I get it. So now I know they're going to think about baseball every time they think about drugs.
Yeah, absolutely. Connecting those stories is super important for teaching. And I think I remember, your nausea story. I don't think I'll ever forget that one, or just how you connect foods to nausea and stuff like that. Anyway, so does the new curriculum sort of help with infectious diseases? Does it help us learn in that regard?
I think so. So the new curriculum, as you've experienced last year, we have that intro module for ID, but I think as you go through each system that you kind of get what are the ID things that happen in each system. And so this year for the third years, I think one of the last remaining few ID related things that you're going to get is HIV. So get ready in 2 weeks for that one, because that one's a beast on its own. But like,
Oh, no.
like incorporating in though, like Dr. Barber incorporated in endocarditis into the cardiology module because it infected the heart, or Dr. Sober talking about pneumonia in the respiratory module because it impacts the lungs and how you're going to handle that. And so I think for me, kind of having it systems based is a wonderful way to learn it. Other universities have done it where you just get all of the infections all at once and all you're doing is learning antibiotics, and there's pros and cons each way. And so I'm curious to kind of see your side of how do you like learning it in a systems-based approach and, kind of getting the antibiotics reinforced from module to module to module instead of all in one shot.
Oh, yeah, I'm definitely a big fan of it. I do like infectious diseases a lot, actually. I enjoy it. And, getting that first week was a big dose of it, but it's nice to recap everything in each module and definitely get into the nitty-gritty details. I'm more likely to remember things. Okay. And so for Dr. Ashpole, how do you incorporate your research field into your role as an educator?
Yeah, so as my research field is aging and dementia, like Dr. Wagner said, sometimes it can be hard because in pharmacy, it turns out we don't have very good medications for aging and dementia. And so if I want to incorporate it, it's more like, here are the handful that we have, their limitations, and here are a giant list of everything that's failed. So I like to try to incorporate, talking about aging here and there, to sprinkle in and just remind people. But like Dr. Wagner said, I like to try to pull in examples. I know I've talked to you guys a lot about my experiences in the past and try to relate things when I can and interject the stories. There is a slight way that I do some neuroscience. So obviously when you study neuroscience and particularly learning and memory and how that changes with advanced stage and dementia, I do make a conscious effort to try to teach differently, incorporate different techniques, because I know about different learning styles and how different people learn. And so, some people are very auditory learners and some people are very visual. And so I try to include that and some tactile learning and things to just try to speak out. When there's 110 of you in the classroom, not everybody's learning the same, and I understand that, and it's not a one size fits all type of equation. So I try to do that. I don't know how effective it is. I have gotten some feedback from students that appreciate, and others that maybe wish that I would teach their style a bit more. But I know it's so much information for you guys in such a short amount of time, so many medications to go through and everything from the pharmacology to the toxicity to the dosing. And that's a lot for the human brain to put in a short amount of time. And so I try to put in tools in place, at least in the CNS psych module that I'm in, to try to help you get that information in. Because at the end of the day, I don't want you to just memorize and repeat back to me something. I want it to make sense and connect so that you can kind of go back to it. And if you don't know in the future, that you know what resource to go to try to find the information. Because I think that's really important. It's, 2020, you have access to the world in the palm of your hand. And so I just hope that at the end of the day, you've learned which resources are good resources to find drug information and which ones are not, so.
Absolutely. And let's see. So continuing on Dr. Ashpole, what are some of your favorite stories from teaching and within your own lab?
Yeah, so it's in teaching. I've really enjoyed your class. I'm not biased. I love all of the pharmacy classes, but this is my 4th year with you guys. And so to me, it's just been really exciting to get to know, yeah, you are the best, to get to know you all throughout time and just see how things change and see how people come out of their shells when they've gotten to know me. And when I've gotten to know them. So I just really enjoy interacting in the classroom. I think that's why it's been a bit of a struggle for me to teach online in the COVID year, because I can't see your faces. I've gotten so adapted to looking for visual feedback while I'm speaking. And so this has been complicated. But within my own lab, it's just so exciting to see people succeed or get to the next step or have a breakthrough, not maybe a scientific breakthrough, but a breakthrough in an ability to do something they couldn't do before. And so this last year was just really rewarding to see. I had 2 PhD students in my lab who just graduated, so new doctors out of my lab. One is headed off to Harvard for his postdoctoral studies. Another one is doing an internship in industry. And so to see them fulfill, a PhD is so much effort and so much time and so much anxiety. To see them be able to fulfill that and then get to that next stage is awesome. I've also had a lot of undergraduate students who've gone on and are doing great things. So I get a lot of pharmacy researchers, but I also get students who are pre-med, pre-dental, everything else. And so to see them all go off and to do their own PhD in neuroscience or to get accepted into medical school, I just love watching those. And then if I could just give one smaller example, this last week I was watching Celis Hayes, who's a second year grad student in my lab. And he and Jess Marshall and Braden Thomas are my current graduate students. And it's like I was watching them interact and just thinking, man, I have such a great lab. Really, these people, I love watching them kind of bit off of each other. And then, you go from that laughing and joking and then watching Celis do a surgical technique that it's like, I don't think I could do that. But here he is, and he's my mentee, and he's doing something I couldn't do, and that's just really rewarding to see.
Oh, yeah, that's absolutely fantastic. And by the way, Celis was actually one of my students back in the day, well, when I used to tutor for organic chemistry. So it's good to hear that he's in your lab now, and he's doing well. I noticed he was doing his PhD program, so that's fantastic.
Well, you can take a pat on the back as well. He's doing great.
Oh, he's awesome. Yeah, he's great. So Dr. Wagner, what are some of your favorite stories with students in your work with ID?
I actually love seeing students grow in their ID research skills, especially when they finally understand the method to my madness, when I make them do everything themselves. So I'm very much a hands-off learner, as you are going to find out. So I really encourage everybody that gets involved with me doing ID research that try it yourself. Try it yourself first, and I'll give you a template and I'll give you an example, but I need you to try it first. When you get stuck, come to me and I'll help push you past that barrier and let you keep going. And so in that regard, I've had several students then with me who have, developed their research skills and done all that and then gone on to residency and come back to me to be like, I am so glad you made me do all of that work because I had to design my whole thing in residency. I didn't have much help from my research preceptor, so I had to do it myself, but I fell back on what you taught me to do. And so that's been really cool to see. But I have 2 of my students, both of them, I don't think they were my advisees, but 2 of them they had done research with me. One of them were almost done publishing the second part of his project that got started when he was a student, and then which has since evolved into a multi-center study that his name's going to go on. But he went on to do a PGY2 in infectious diseases. And so now he's a starting a new job as a stewardship pharmacist down in Florida. So to kind of see him do that, and he went to Henry Ford. And so that kind of just, made me all happy and smiling inside, because it's like, that's where I trained. And so, he kind of went and did the same thing. And I have another one right now. She's currently at Henry Ford doing her PGY2 in ID, and being able to do ID research and do all those things. And so it's like, I have two kids that, kind of went the same, similar route that I did. And, I'd like to think that I helped them want to do ID and do ID research and kind of get as much experience as possible. But it's just, we had a family discussion the other night. Like, we all got on FaceTime and we all chit-chatted and said hi and caught up and stuff. And it's just kind of keeping that mentality of, again, and referring back to earlier when I said about Twitter, like, we're all this big, huge family. And we actually start creating family trees as to who's related to who by training. So, my fellowship director is like my mom. And so, like, my kids, my two students that have gone on there, then she's grandma to them technically, like if we go training kind of deal. And so it's just, it's a different way of thinking about things, but I think it helps to reinforce family and that we're all in this fighting organisms together and taking care of patients. And so I think, it just makes me happy inside when I see, that kind of thing happening, either research skills being used forward or just research and ID moving forward. Makes me really happy.
Yeah. And so you guys both keep in touch with your students?
Yes, absolutely.
For sure. And for people who are interested, there are actual family trees in science that you can find online. You can track people's training. It's pretty cool to see back, like, how far it takes for you to get to a Nobel laureate. And it's only a couple generations for me. So
that's pretty funny.
I'm pretty much one myself then.
That's pretty funny. And Dr. Wagner, I'm definitely looking forward to researching with you this year. I see what you're saying. It's definitely just like on my own pace, and I definitely respect him like that. So, okay. So our next question, how do each of you balance your interests? Whether it's home life, mental health, work.
Dr. Ashpole, please feel free to go first.
Okay. Well, I will start with an honest answer that I do not have a good balance. So it's something I'm working on. It's something that it seems like I'm constantly working on. I don't know what it is about me that I'm like all in on something, and it to my own detriment. And so I'm working with a therapist to try to figure out how to bring about a better balance in my life. But I'm passionate about work, and sometimes it becomes a little bit too much, right? And so I need to take a step back and try to find myself and find, like, what are my hobbies and what are my passions out. So I'm working right now.
I gotcha. And so Dr. Wagner, how do you balance everything?
Well, I guess I went through something similar to what Dr. Ashpole went through, except potentially a little bit earlier in becoming a faculty member, where I think I took on too much and kept bringing work home and didn't realize how stressed and shorted out I was until I went on like almost a 3-week-long vacation, and it took me a full week to like let everything go from work. And so that kind of helped me realize, okay, I really need to change things. Like that vacation helped me recharge and kind of start reprioritizing things. Some of the other things that I started doing, I started really making sure that I worked out every morning, that was kind of my, outlet for things. And then I got a dog. And so he's kind of helped in the afternoon because, when I was physically going to work, he would be in his cage from the time I left the house until I came back. And so that's, roughly bordering on 9 hours-ish. And so it's okay, he's wired and like ready to play and like just wants to be with me because I'm his whole world. And so that helped keep me focused on him in the afternoons and evenings instead of trying to bring work with me. And so I think that has really helped me kind of keep it that way. And then I had to go through a transition once I started working from home with COVID. Because when work is at home and you don't get that physical separation of driving, you're like, well, it's so easy to just walk over and sit in front of the computer and keep doing stuff. And so I needed to make it a very strict point of no later than 5 p.m. At 5 p.m., everything has to stop, and I'm not allowed to come back to my computer in the evening. I just can't do it because I know I'm going to fall back into that, well, I'll just keep doing it. And so unless there's like a massive deadline, like a promotion packet or a manuscript with edits that need to get turned around and I'm a little behind, so there's always exceptions here or there, but a majority of the time now is at 5 p.m. I'm done. Like I get out of the room and I don't touch my computer again because it helps keep me more balanced that way. So I still wake up in the morning and work out, and then I'll come to work in a room and sit in front of my computer and kind of do my thing. But then 5 p.m. I'm done, and I get out of this room and I don't come back in until the next day.
Yeah, that's fantastic. And we were having discussions about burnout previously. What was that book you recommended about?
So the book that I use to kind of also keep me in this mindset of figuring out what I truly need and want, career-wise and in my personal life was Essentialism by Greg McKeown. That really kind of helped me figure out where something would fit into my life. And if it didn't fit in, then I got to say no to it. And just in general for faculty, a lot of us are trying to reach promotion. And so it was, okay, is this going to help me get promoted? Is this checking a box or not? If it's not checking a box, then I can pass on it for right now. And so just trying to keep little things in mind that might sway me one direction or another. Sometimes I'm like, you know what? No, like I really kind of want to do this. I want to still give my time to something. Okay, well, I'll make an exception here, but it's just keeping tabs on those exceptions so that your exceptions don't become bigger than what's required.
So let's see, we have just a couple of minutes. I'll ask one or two more questions. Dr. Wagner, what advice do you have for students who are interested in research and pursuing a career in academia?
Get involved early. Get involved as early as possible. And even if you're not sure who to reach out to, so all of you are going to have your advisors. We all know each other and we all have a pretty good idea of who's doing what. And so if you were to come to me and say, hey, I really love heart failure. Well, I'm like, well, heart failure is not really my jam, but Dr. Pitcock, he got you. And so I would connect you with that person. So even if you're not sure who to talk to, you can at least go to your advisor and say, I really like this topic in school. Is there anybody doing research on this? But I think the other thing to keep in mind, research doesn't always have to be a project. You can go ahead and write a column for a newsletter or, write a review article with a professor that's working on something, and that's still considered research. So I think, kind of keeping an open mind that research isn't this black and white box of, I have to collect data. It's not that, it's all encompassing. And so kind of thinking about it in that terms can kind of open some more doors. But once you find that professor that you click with, like, talk to them, learn their story, ask their advice on how to navigate different things here or there, how to find the articles, how to come up with ideas, like really get into that research process if that's something that you're really interested in doing.
Thank you. What advice do both of you have for incoming P1s regarding classes? Any advice you have for them? And you guys have already given a lot of advice, so if you want to pass, I understand.
I'm going to let Dr. Wagner start on this one.
Oh boy. So I think it's take one day at a time. Keep yourself organized. There's going to be a lot of information coming at you real fast. But if you kind of have your own way of keeping track of when our exams going to happen, when our homework's due, when do I have to go to class, to kind of just keep a schedule. When I was in school, it was all on paper because electronics, we were still slowly working our way into electronic means. But if you have an electronic calendar to block your time, I think it's a cool mentality, so to speak, to get in. It's called Time Block, and there's actually an app for your phone called Time Block, where it tells you are allowed to work on specific things. You set it up, but it tells you are allowed to do specific things during certain time frames, and it'll chime you and tell you, hey, okay, it's now 2 p.m. You said you were going to be done with this topic. It's time to move on to the next topic. And so it kind of keeps your mind interested, but allows you to go to something different. So it's a new thing, and so you get excited about it. But I think making sure above all else you take care of yourself. So in pharmacy school, I had at least 2 days a week where they were my designated TV days, where I didn't touch schoolwork. So I had Tuesday nights with my family and we watched Biggest Loser after dinner for 2 days. And then Thursday nights, I would go ahead and go to my aunt's house. She lives 6 blocks away. She would make dinner. I would bring dessert, and we would eat dinner, and then we'd watch Vampire Diaries and Grey's Anatomy. And that was my Thursday nights. So for me, it was, making sure that you have relaxation time built in, however you need it. If it's TV, if it's a book, if it's another hobby, something. Make sure you have something outside of pharmacy school that can help you detach for a specific period of time to relax.
Thank you.
Yeah, I think to me, sometimes I get worried about overcommitment in pharmacy, at least in the beginning. There are so many pharmacy organizations and, you don't have to be a member of all of them. You could be a member of those that are interesting to you, that you're passionate about. You could be a member of an organization that is not within the school of pharmacy as well. So just try to avoid the overcommitment in the beginning. It's really great to get to know people and connect. I'm speaking to Hershey here. Try to avoid some commitment in your student organizations. Yeah. I think a bit, because you're just adding stress on yourself. You see people stressed about being, the secretary of this and this meeting coming up. It's like, all right, well, do you think that's probably your biggest priority at this time? And then the other thing that I would say is, we're not that scary of people, so get to know your professors. We enjoy seeing them. Dr. Lay would love for someone to come to his office hours. He says it like every class.
He does.
So get to know us. Come ask questions. It doesn't always have to be just about school, but we want to learn about you just as much as you want to learn about us and our random dogs and things going on too. So yeah, that's my advice.
Thank you guys so much. It's looking like we're at the end of our time. And so just wanted to, again, say thank you guys for talking to me. And I'm glad I was invited to this. Thank you, the PharmChats people, for inviting us all to this. I think it was really enjoyable and educational. I think a lot of people will get a lot out of it. So
yes, thank you very much.
Yeah, thank you for having us.